just heard from Professor Center that a lot of people have fractures and they're not being treated for it. And I'm going to dwell a little bit more on that. And we call this really the osteoporosis care gap. With other words, that the majority of people who suffer fractures actually not being looked after. And we have a motto for what we initiated about a year ago, the National Alliance for Secondary Fracture Prevention, which means the alliance that wants to work for all Australians so that if they had a fracture, that they're not going to have another one. You just heard from Jackie how great the risk is for these people to have another fracture. So our motto really is to make the first fracture the last. Of course, it would be wonderful to make sure that nobody ever has a fracture, but this at least is the low-hanging fruit and the most cost-effective thing. Now I'll just present you with a patient of mine who's actually a university professor. It's not me. He's a bit older than I. But in March 2016 he had a left hip fracture, as you can see here. It's actually the right hip here, so I turned that photo around, sorry. I was surgically managed. He went to rehab and then home. He did okay. He still has difficulties with walking and managing his daily chores, but he's all right. In May 2016, so 2 months later, he was then referred, or actually captured, by our fracture liaison service that we have at Concord Hospital. So we go around and try to find and identify those people, and many other hospitals do this, including St. Vincent's here, and North Shore and Royal Prince Alfred, etc. And when we find these patients, obviously we talk to them, we investigate, we want to know what's going on, and we find out for this man that he had rib fractures before at the age of 61, which is not so unusual for people with COPD, with chronic lung disease. But also he had a right wrist fracture after a fall at age 65. So he now had 3 fractures. He had several, actually more than 4 fractures. He had 2 rib fractures, he had a wrist fracture, and now he had a hip fracture. And that is a very typical career of an osteoporotic patient. But when we saw him, all he was on for his pain was paracetamol. Nothing for his bone, no vitamin D, no calcium, no other treatment. When we further looked at him, he obviously had several vertebral fractures. You can see them here. One, there's another one, there's a beginning one, right? You could see that his bone density is quite low, if you know how to interpret X-rays. So he's a classic, he's an absolute typical patient. We see those patients all the time. Previous minimal trauma fracture, surgically managed, or sometimes with a cast for a wrist fracture, but absolutely nothing in terms of asking questions. Why do you have these fractures? It's not normal to have fractures. Even as you get older, it is not normal. It's not a sign of getting older. It's a sign of a disease called osteoporosis. He never was diagnosed with osteoporosis, and obviously, as a consequence, he was never treated for osteoporosis. And we know, and this is again, it is so classical, we know that half of all women who present with a hip fracture at some point in their previous history, in the previous years, actually suffered a wrist fracture. So actually these people, these patients, put their hand up, no pun intended, and actually say, look, I have a problem. This is what we call a sentinel fracture, or a red flag fracture, that really every patient, all of you, your GPs, every doctor, every person should be really alarmed if somebody has a wrist fracture, because it's often the first sign of something being really wrong. So it's not just a fracture, it is actually a warning sign, okay? And Jackie has just shown you these data. This is data from John Eisman here from the Garvan Institute, with a lot of people, postmenopausal women from Australian GP surgeries. 29% had low trauma fractures. Only 28, 1/4, a quarter, were actually treated. And this is another study a few years later from Royal North Shore, from Phil Sambrook's group. Again, 37,000, nearly 38,000. Only 3.8% of those 17,000 who had fractures were actually on treatment. So you actually wonder what happened from 2004 to 2008. Rates dropped from 28 to even 4% now. So it's pretty bad. We are doing really very badly. And it's not just in Australia, let me assure you. It is a worldwide problem. And really, the message is that 70 to 80% of patients with osteoporotic fracture go undiagnosed and untreated. And that results, as Jackie has shown you, in further fractures that could have been avoided if somebody would have taken notice of the sentinel fracture. So as John often says, we are at the world's worst practice. Why is that unacceptable? Well, as Jackie just showed you, people fracture again. People get sicker with every fracture. People die from fragility fractures. You've seen that. They all start alive and then they die. And it's also a waste of money. Okay, I need to be closer. Okay. But why is this even more unacceptable? Well, because we have effective treatments. We have treatments that went through very rigorous testing and have shown that these treatments reduce the risk of fracture. And they are available here in Australia. And the government actually, via the PBS, provides access to these treatments at a very affordable price. So they're safe, they are effective, they're available, and we still don't use them. It's amazing. It's just absolutely amazing. Okay? And this is a slide from Kerry Sanders, who showed this actually, what's today? Friday? I'm slightly confused. Too many travels. What was that, on Wednesday, right? In Canberra. Thursday. Okay. No, it was yesterday. You're right, John. Yeah, he was there as well. I was somewhere else in the meanwhile, Melbourne and Adelaide and now here. So this is Kerry Sanders showed this slide to the Minister Ken Wyatt, that's the Minister, Federal Minister for Aging and Chronic Disease, etc. And what this shows actually is that the proportion of patients initiated on these treatments has actually plateaued, right? But down here, really, it shows you who is really on treatment. And there's this huge gap here. There's a huge gap. Why do we let this happen? Well, we don't really, there's not a single cause here. One is clearly there's a lack of awareness. And these meetings here are very important because you now know more about osteoporosis, and I hope you go out and talk to your friends and family about this terrible disease. Obviously, when you go to your GP, GPs often don't have a lot of time for you because they really look after a lot of other diseases and conditions, so there's competition between those various diseases, and osteoporosis often falls down because it's sort of perceived as not being so important. And then obviously there's not a single profession that really takes responsibility. There's all sorts of doctors look after this, including geriatricians, endocrinologists, rheumatologists, GPs, etc., etc. So there's no real peak body for this. And this is why a year ago we founded the National Alliance for Secondary Fracture Prevention, but by now has 32 members and represents about 3 million patients, or people, I should say, people. And hopefully this will have some effect on our politicians, both in Canberra and in the various states, to convince them that this is actually something they cannot ignore any longer. So how can we close this gap? How can we close this appalling, I must say, indifference towards patients with osteoporosis, and particularly with osteoporotic fractures? Well, the only thing which we really know works is the secondary fracture prevention program. Some people call them fracture liaison services or osteoporotic fracture or refracture prevention services. There are various names, but the ones that are effective follow these 4 I's, and that is that once a patient has suffered a minimal trauma fracture, they get actively identified, and you see I repeated this word actively here 4 times because it is an active process. We can't wait for these patients to come to us. We actually need to go to them. We need to identify those patients. We need to investigate them actively, then initiate them on treatment as appropriate, obviously, and you'll hear about that more later. and then integrate them into a primary care program that really makes sure that these patients are being followed up and makes sure that those patients actually remain on therapy, because osteoporosis therapy is a long-term management issue and not just sort of taking a tablet and that's it. Okay, so it's identify, investigate, initiate, and integrate. And we know from a number of studies, and this is just one of them, and it's obviously the best, that's why I'm showing you this slide, and it comes from us, of course, we can show that these services, these fracture liaison services, secondary fracture prevention programs, actually have effects. Maybe not always 80%, but the message is very clear. If we look after those patients, and that's these patients down here, over 4 years, and we have data now for 10 years, we can consistently show that we can significantly reduce the number of further fractures. Whereas if we don't do anything, these people will just keep on and fracture again and again, as the patient I showed you. So really, in conclusion, the current situation is absolutely untenable. It's appalling. It is disgusting. All right? Most patients with osteoporosis are being denied management, care of their disease, which is really unheard of. Just imagine somebody with breast cancer is not, they take the tumor out and that's it. Or somebody with a heart attack, they put a stent in, and that's it, go home, have the next one, see you later, right? And that's basically what it is. People go into hospital, come out of hospital, and go in again, and it's sort of this revolving door problem. We have solutions to this problem. It's not that we can't do anything. We have solutions to this. We know what we can do. We have fantastic treatments available. They are effective. They are safe. You will hear about this. And this whole thing is really cost effective. If we can prevent fractures, we can save a lot of money that can then be used for better things, for more important things. So the Fracture Alliance hopefully will be successful, along with other groups such as Osteoporosis Australia and the Hip Fracture Registry and other groups, to actually make fracture prevention for patients with osteoporosis a reality. Thank you very much.